Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
All right, and welcome back, everybody. This is Dr. Thomas Grove. You're listening to Living Pain-Free, the educational program. We're talking about your musculoskeletal orthopedic needs. Again, listen, joints, ligaments, tendons, muscles, right? Anything in the musculoskeletal system that's bugging you, right? Maybe causing some pain, discomfort, feeling a little loose, a little unstable. Regenerative medicine now, this is a powerful tool that we like to use. PRP, stem cells. These are the healing cells of the body. You simply walk in for your treatment. After you get a couple of injections, you walk out, let that healing process start for yourself. And the goal is to, decrease your pain, increase your function, and keep you out of that operating room, right? We want to try to avoid an unnecessary elective orthopedic surgery. So, Jennifer, I see you. Give me 1 second here. I'll give out that number again. We'll get some more callers. We can talk to you live in the studio. Number to call live here, 866-870-5752. That's 866-870-5752. If you give us a shout, we're going to send you a copy of our book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. If you're ready for that consultation for free over the phone with our staff, check us out. We're at 800-300-9300. That's 800-300-9300. And if you want to send us an email, get in touch with us, check out some videos of us doing these procedures, check out some research behind regenerative medicine and lots of educational content. Check out our website. We're at www.jointrehab.com. That's www.jointrehab.com. Jennifer, Thousand Oaks, how are you?
Hi, I'm so glad I found you this morning.
Oh, that's awesome. What can you help me with, Jennifer?
So I'm almost 60 years old. I'm not an athlete in any way. And for the last probably 2 years, when I sit for a long time, when I stand up, I feel like I'm 100 years old. Like my legs, it's very hard to straighten them out. They're very, very tight and painful. And I had some x-rays done just in my GP's office, and he said, oh, yeah, that's osteoarthritis, and it looks like you got some bone spurs, and you probably need to go have surgery. And that seems like sort of the last resort for me. So finding something like you to, maybe prevent that would be amazing.
Exactly. Yeah. Well, hey, Jennifer, the universe brought us together here this morning. So this is exactly where we live, right? So we see a really big disconnect. A lot of times the first point of contact is going to be maybe urgent care or your general practitioner, right? A lot of times they just don't really have the advanced musculoskeletal training. So, really what they have to offer is like pain pills, steroid shots, and then if that doesn't work, surgery, right? None of which is actually healing the tissue. That's exactly where we live. I've been very fortunate to get some of the best training in the world. And so, again, a lot of family medicine, internal medicine, lots of time in the operating room, emergency room, trauma bay, ICU. And really my sports medicine specialty is being a team physician for many years. So I've been around a ton of athletes, a ton of musculoskeletal injuries, and I just see a huge, chunk of patients that could benefit from this sort of treatment. They just don't know about it, right? So very happy we got to connect here this morning. So anytime that you get a static image like an x-ray, and you have maybe some bone spurs, that just tells us, hey, this is somebody who has some arthritis. I'm not so interested in bone spurs. I'm more interested to see, what is our range of motion? How functional is this body part? So we're talking about specifically like your knees? Is that what we're looking at?
No,
or
my
your
hips.
Hips,
and I can tell you, my range of motion is extremely limited.
Mm-hmm. Yeah, so again, the next thing is going to be, properly getting you a good physical exam and scan that hip to see exactly what's going on. Because hips, once they go, right, just like any joint, right, there is a time and place for surgery, certainly. We just find that it's a much, much smaller number of patients that really need these sort of surgeries. So again, I'd love to get you in the clinic, Jennifer, and take a look at that hip and see exactly what's going on. Do you have any pain that's like going down the leg, or is it just really more around that hip where you're having some pain?
Nope, it's just in the hip joint. Occasionally, sometimes there'll be like a period of a week where I get like a shooting pain sort of through the hip, and then that just goes away.
Yeah. And man, this is a really good talking point too. I caught a couple of these here this week where someone came in and they thought, man, I just have a really bad arthritic hip. But we have so many structures around that hip. You have to understand on the inside of it, the front side, the other side, the back side, a lot of muscles, ligaments, and tendons. That if those are damaged or they have little strains or they just get stretched out, can kind of mimic pain around that hip. And a lot of times, because we're so prone on getting people into surgery, we don't really give those sort of structures much attention. But I'm telling you, I catch that almost daily. Where someone is told they have, really bad arthritis, they need a joint replacement, but their pain is actually coming from somewhere else. So around that hip, again, we've got a lot of structures that, again, with a good physical exam, we should be able to tease that out in terms of where those symptoms are coming from. But yeah, we see a lot of this kind of thing. So yeah, hopefully, Jennifer, we can keep you out of that operating room, keep your native tissue, go the more natural route here with these injection therapies.
And being close to 60 is not a big problem?
Nope, not at all. So that's another great question I get almost every single day, sometimes a couple of times a day. I get a lot of folks that are in their 90s. I've had a couple patients that are in their hundreds. They still get great results with this sort of stuff. The big issue with, I think it's a kind of an outdated sort of thing to assume, is because the early treatments, we didn't really know what kind of dose to use for stem cells and platelets. And now we have so much good research looking at, the concentration and total amounts of cells and how much blood are you supposed to draw. How do we, source these sort of materials and get more efficient? And so now the age thing isn't as much of a factor. So the old school version of some of the original platelet-rich plasma, which is kind of a less strong version, there was a pretty good correlation that you needed a minimal effective dose. For our folks that are maybe over the age of 50. Again, we use a good dose on everyone that we treat. We just find the success rate is much higher. We don't want to skimp out on that side of things. But yeah, age does not have anything to do with that factor whatsoever today, which is a really great thing, right? That's pretty exciting.
Great.
Excellent. Well, Jennifer, let me give you that phone number and you can get in touch with our staff here. That number to call is 800-300-9300.
Wonderful. I will call them right now. Thank you so much.
Looking forward to meeting you, Jennifer. Thank you so much for your call.
Yeah, me too. All right. Bye-bye.
Bye-bye. So great example there, guys, of, if we have a surgery maybe that you're considering, again, this is something that it's not going to be bad to get some more education, right? I'm a really big proponent. If you've got, any sort of invasive procedure that you're considering, man, check out all the options that you have. Make sure you're going to different types of providers as well. Again, you go to a surgeon, a lot of times they like to do surgery. It's not everybody, obviously, but that's something that, is obviously offered. Again, I'm somebody who's been in that operating room. I did a lot of surgery in my training, so I've seen a lot of these sort of outcomes. I don't do that sort of thing today. What I do is injection therapy, right? So if I, think this is something that we can take care of, and again, you have to understand, I'm treating a lot of patients every year. We're doing a couple thousand treatments a year. Again, I've got a lot of experience in the sports medicine world, right, at the high-end level of professionals and college athletes, Olympic athletes. So I've got a lot of really great experience with these sort of injuries, and if I think I can, get you some help, I'll be honest with you and try to steer you in that direction and go more conservative. At the end of the day, even if it doesn't work, God forbid, surgery is always still something that's on the table. But like Jennifer just mentioned, that should be the last resort. We should not be leading in with these big invasive surgeries, because if this is something that we can take care of with some injections now, hey, this is a much better route to go, much safer, much quicker in the recovery time. And again, sometimes you need to come back after a couple of years, maybe you re-injure that area. A lot of patients will ask me, was this like a one-time thing? It really depends on the patient, right? You have to understand we're treating a very active patient population. So typically whatever brought them in, right, after we get them healed, they're probably going to go back to doing that same sort of activity. We've had some pretty extreme athletes in here the last couple of weeks. And so those are folks I'm sure I'm going to see again, right, eventually, right? I can heal that tissue up, but is it going to, put you in a bubble wrap forever and keep you safe, right? If you got to be smart about what you're doing with the exercise component, right? Looks like we had another caller coming in here. We've got Melody from Ventura. Melody, how are you?
I'm doing great. How are you today?
I'm doing great. What can you help you with?
I have a lady friend who has neuropathy in her leg and is now confined to a wheelchair.
Oh, I'm
sorry. Is there anything you can do for neuropathy?
Yeah, so it really depends on, what the cause of that neuropathy is. There's a lot of causes of it. So neuropathy is just saying, hey, there's something going on with our nerves. A lot of times you get kind of the sensation of like pinpricks. Sometimes it's like really searing, burning pain. Other times it's just kind of numbness, right? So we see a lot of this in folks that are things like, diabetic, right? So if someone's got diabetes, those nerves can kind of get fried, so to speak. Do you know if your friend is a diabetic at all?
I don't know for sure.
Okay. Yeah, so just over the radio, there's a ton of reasons, right? Diabetes is a very common one. If they're a alcohol drinker, that's a really common one as well. Alcohol and nerves don't really mix. It could be nerve damage, right? It could be a vitamin deficiency. It could be a vitamin level that's too high in the blood. There's all kinds of issues. So for neuropathy, there's a lot of really basic things that you can rule out with some blood tests to begin with. So that's kind of the first initial place that I would start with to see exactly if there's something that kind of a low-hanging fruit that we could address there. Okay?
Okay. And by any chance, she is on Medi-Cal. Is there any Medi-Cal coverage?
So sometimes for the blood work, that'd be something to look into. Yep.
Okay. All right. Well,
Excellent.
I certainly do appreciate your help there.
Yeah. Anything else I can help you out with, Melody?
No, I think that's it, and I enjoy listening to your program.
Oh, thank you so much.
I'd like to get the book.
Oh, yeah. Here, do this. Give us a call here, and we'll send you a copy. And again, anybody that you know too, we'll get you hooked up. That number to call is going to be 800-300-9300.
Perfect. Got
Excellent.
it.
Melody, thanks so much for calling.
Thank you. Have a good day.
Of course. You as well. Yeah, so for neuropathy, guys, lots of different causes of that. There's just so many possible issues that are going on there. In terms of nerves, a good talking point here, too, is if someone's got what we call a nerve compression, that is something that potentially that I could address. Your typical thing that we see is a lot of carpal tunnel, right? So that's just the median nerve that goes through the wrist. Sometimes it gets pinched down. I talked about that, I think, last week, but I do something called a nerve hydrodissection. So it's kind of a non-invasive way to try to take the pressure off of a nerve that's getting pinched down. So there's lots of different what we call entrapment points, and this is where the many years of training that I did, now getting really good and proficient with that musculoskeletal ultrasound, I can find that nerve and track it the whole way and see exactly where that nerve is being pinched down. So if someone's coming in with, some new onset of, numbness, tingling, that kind of thing, that's a potential sort of treatment that we can do, right? So a lot of times the nerve's getting pinched down. Sometimes there's just kind of a chronically inflamed nerve. And the power of the regenerative medicine is kind of multifold here. So, what we do, there's definitely multiple components of pain for a lot of folks. This would be like more of a neuro and a chemical sort of issue here. So if I've got, a nerve that's being irritated and we're trying to decrease inflammation, long-term, right? PRP and stem cells is a great option. And then what we're talking about here for nerve entrapments is more of what we call the biomechanical aspect of pain. So it's literally just, getting, pinched down. I don't know if you guys have ever been, sleeping at night and you wake up, you're like, man, my arm is like totally numb, right? That's just you, laying in an awkward position. It's putting a little pressure on that nerve. It's giving that sort of sensation. And so sometimes that's, post-traumatic. Sometimes it's an overactive muscle, scar tissues, all kinds of things that could potentially cause that for folks. So I did a couple of those here last week on some foot drop. I did another one for the ulnar nerve at the elbow, median nerve at the wrist, posterior tibial nerve down in the ankle. So there's lots of common little entrapment points that nowadays, because that ultrasound is so dang good, higher definition than MRI, I can see these nerves now. So it allows me to do these sort of procedures and be very safe. It's a really fun, kind of satisfying to watch on the screen as that nerve is becoming unpinched, right? And so a lot of times if we can get to these sort of issues sooner rather than later, there's a good chance we can get you a little bit of relief there. So that's kind of the sort of treatment that we deal with nerve problems with folks. So that's kind of a fun one to do. So we got a couple more minutes left here in the show here, guys. Love to get you to give us a call, get some more callers in here. This is Dr. Thomas Grove on Living Pain Free. Musculoskeletal program. We're talking about your aches and pains. Maybe you got some pain after a fracture, a dislocation. Maybe you got some arthritis, some joint pain going on. We treat head to toe. We like to use regenerative medicine, PRP, which is platelet-rich plasma, and then stem cells from bone marrow. To get PRP, simple blood draw. Spin that blood draw down into a centrifuge, concentrate down those platelets and growth factors. We can use that to inject. We can also use the bone marrow, numb up the back of the pelvis. You can extract some bone marrow, spin that down. That's something that we can also inject in. Again, both are good. Stem cells are kind of the premium treatment that exists today. It's just a much more profound healing effect that you can get, a little bit more of a powerful tool to address some of these musculoskeletal issues. But let's talk about it here. Give us a call live in the studio. We're at 866-870-5752. That's 866-870-5752. And just like Melody called here, we'll give you a copy of our book for free. Give us a shout. And if you want to get a consultation over the phone with our staff for free, that number to call, 800-300-9300. That's 800-300-9300. And if you want to check out our website, spot on every page now for you guys to shoot us an email. Check out some videos of us doing these injection procedures. We're at www.jointrehab.com. That's www.jointrehab.com. Got a good email in here. This is fresh off the press here. This is somebody who's sending me an email saying, hey, I'm 74 years old. I've got osteoarthritis in my feet for 30 to 40 years. Now it's in my hips too. Been to orthopods many times. I've had gel shots, cortisone, no luck. Any suggestions? Is artificial cartilage ready yet? Been to orthos. Can you help? All right. So this is somebody who's got some arthritis, so they're told. So in the feet, some good talking points here too, guys. I mean, hands and feet, they're really concentrated areas of anatomy. There's so much stuff in such a small area. That was definitely one of the more challenging areas to master with anatomy and with the musculoskeletal ultrasound. But I'm telling you, what an amazing tool that I have now. I can look with that ultrasound and see all these tiny little structures, be very specific with my physical exam and determine where someone's pain's coming from. So if it's regular run-of-the-mill osteoarthritis, there's a lot of little tiny joints in the feet that are really tough to get to without that ultrasound. So it's a really fantastic tool. I can use to guide that needle in. A lot of times, little ligaments, little tendons, little muscles are involved as well with pain in the feet. But again, good physical exam will tease that out for you. Same thing with the hips. That's a little bit bigger structure, right? But like we talked about with Jennifer, with her hip pain, there's a lot of different areas potentially that could be causing some issues for you. So you got to do that physical exam. Looks like this is somebody who had some gel shots with cortisone. So gel shots, if you guys don't know, another name for that is called hyaluronic acid. That's a predominant component in something called synovial fluid. That's just your joint fluid, right? So kind of an outdated treatment, in my opinion. When we're looking at hyaluronic acid, not really great for tissue healing. At best, maybe a couple of months of relief just to give you a little cushion. But we don't really see many long-lasting, patients with that sort of treatment. So we're not really prone to guide people down that line. We don't really do that anymore here. Much better off is trying to get some healing cells in there. In terms of research as well, PRP and stem cells is a much stronger sort of treatment to evoke inflammation and to get some healing going. So we're not big fans of gel shots. It's kind of more of a temporary issue. Like we talked about earlier in the show, this is somebody who had cortisone. We're not big fans of that for long-term pain relief. It really is a bad idea because it causes more damage, makes the pain worse long-term. The trade-off is you might have a short time period where your pain is improved, but it's kind of a false sense that you're feeling better because the tissue is actually getting more damaged, right? So cortisone shots, especially when you're doing multiple cortisone shots, bad idea, guys. We want to try to stay away from that as much as we can because we don't want to make that problem worse down the line, right? So if you do a couple of steroid shots, now that joint is totally wore out, a lot of times you're just left with one option. That's an invasive surgery, right? So if we can get to you before that surgery, hopefully reverse some of that damage that's done, get you some more function, decrease your pain. It's a much safer bet for you. This is somebody who mentioned they've been to multiple orthopedic surgeons. Like we talked about earlier in the show as well, try to, go to different providers, guys. If you're thinking about doing, a surgery, you can certainly visit with some surgeons, but, see if there's somebody who sees this sort of issue and has, success with treating it. Like Jennifer was mentioning earlier in the program here, she had some hip arthritis. Sounds like she's still pretty functional. This is somebody that potentially we could help, right? I can't say for sure over the radio. But this is something that we see very frequently, where we see a lot of folks who are in pain and they kind of get, pushed or funneled directly into a surgical consultation, and we overlook, the healing therapies, right? We like to use platelet-rich plasma and stem cells over here. But these are really powerful tools that potentially can keep you out of that operating room, which is our, big goal, right? I want to keep your function. I want to decrease your pain, keep you moving, right? And try to avoid an unnecessary surgery. When we talk about things like joint replacements, a lot of times people think, oh, it's just like a one-time thing. Like I talked about earlier in the show, I had a guy who was in his 30s thinking about a hip replacement, which is just like a crazy idea, especially considering how functional he was and lack of pain in the joint when we stressed it on the physical exam. But this is somebody be looking at multiple joint replacements over their lifetime. You have to understand that joint replacement, is typically not a permanent thing, right? Hardware fails, you have to go in and replace it again, take more tissue out, expose yourself to another risk of complications from that surgery and anesthesia recovery period. So again, what we'd rather do is try to get ahead of that problem, right? Fix that problem, heal it from the inside out, and decrease your pain, increase your function, and keep you out of that operating room and keep you off that hamster wheel that is, surgery, pain pills, decreased, mobility, increased pain, time off of work, right? This sort of negative spiral. We want to try to break that cycle, get your pain under control, right? Get some healing going for you, and hopefully keep your body moving, keeping you functional, right? That's the idea of what we're trying to do. There's certainly a time and place for surgery. We're not bashing surgery. I love doing it. They're very fun to do. It's a very challenging training program to go through. And so these are things that, lead us to really respect physicians in that surgical world. I think they're some of the smartest guys and gals in surgery. In our whole medical field. Very difficult to do. It's just the nature of these surgeries we're not a big fan of, and we really want to only go down that route only if we need it, right? We should not be playing around like, oh, I'm just going to try a joint replacement. I'm just going to try this knee scope, this shoulder scope, hip scope, ankle scope. I'm going to go get, some of my meniscus trimmed out, maybe some of my labrum trimmed out. And again, the issue with this, guys, is these surgeries, they cause a lot of harm, right? Now it's at the expense of, the trade-off of like, well, if the tissue I'm going in to scrape up, remove, drill into, plate, screw, whatever it is, if my symptoms are improved on that other end, right, that's when it's kind of worth it to do those sort of surgeries. But for a lot of these elective surgeries, we don't really see the need to have those. And when you're going in and trimming out, for example, we see a lot of meniscus surgeries, right? Remember that meniscus is a little shock absorber that's between your thigh bone and your shin bone and the knee joint. Also a place for some ligaments to attach, so provide some stability to that joint. So going in and trimming that out, we don't really think makes a whole lot of sense, right? So now you leave that surgery with more arthritis than you had walking into it. And now you've got a little bit more instability of that knee where you're trimming out meniscus that has ligaments attached to it. You're piercing the joint capsule, which also provides some stability to that joint as well. So again, we just don't see the success rate. We see the complicated, cases from a surgery like that. We see the folks that, they're the same or no better, even a year down the line from these kind of surgeries. So we're not big fans of that. We'd much rather, figure out exactly where that problem is coming from, introduce some healing cells directly into that area, right? So considering something like regenerative medicine, I think is a really good idea. Again, you don't need to do anything, but at least, take a look at your options. Again, making sure you're asking your provider, hey, have you seen this before? Are you comfortable treating this sort of condition? How many of these have you done today, right? So that's a kind of a pet peeve of mine is a lot of folks who do regenerative medicine don't really have the training. Maybe they did a weekend course. A lot of times they're not using ultrasound, right? These are all really big red flags that you're not really putting yourself in a position to have a good success rate, right? If you're going to somebody who does one of these every couple of weeks, every couple of months, again, success rate definitely is not going to be near as high as somebody who's doing, every single day. I'm doing maybe 10 plus treatments on people. So we're very, very fortunate to have a very busy practice to help a lot of folks. But those are some major pitfalls that I look out for. In terms of the aftercare as well, I see a lot of people kind of mess this part up too, where maybe they had a treatment with somebody else and then they said, oh, well, they just said, just keep living my life, don't do anything different. So maybe they didn't properly rest the area to allow the tissue to work, right? Maybe they were taking too many NSAID, anti-inflammatory medications, steroid shots. These are all things that'll kind of cancel out or limit your body's ability to heal. But that was a fast show. We're already done here, guys. This is Dr. Thomas Grove on Living Pain Free. Let me give out that phone number, guys. If you want a free consultation over the phone with our staff, that number to call is 800-300-9300. And also check out our website. Spot on every page for you to send us an email. We're at www.jointrehab.com. We will see you next week.
You've been listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.